my name is Crystal Esther, and today I will be performing a third demonstration on preparing and administering oral and parenteral medications. So now is I will be performing preparing injections from vials and ampules and administering intradermal and intramuscular injections. So the materials needed, so we have the tuberculin syringe, sterile water for injection in a vial, then a syringe of a 3 ml, and alcohol swabs, then needle gauge 23, then 1 dry cotton balls, then medicine in an ampule, then a sterile gauze, then a tray with a towel lining. So first is we check the accuracy and the completeness of each medicine ticket with doctor's order sheet. So we check the patient's name, the medication and dosage, and route and time of administration. So for the fourth and fifth medication, so we use the white medication ticket. So this will ensure the patient receives accurate medication, and because the order sheet is the most reliable source and only the legal record of medications. Then we review pertinent information related to medication, so such as the action, the purpose, the normal dose and route, side effects, time of onset and peak action, and nursing implications. So this will protect patients from risk for allergic drug reaction or drug response. So knowledge about medication history influences how some medications act. Then also we assess the patient's body build, the muscle size and weight if giving subcutaneous or intramuscular injection. So this will determine what type and size of the syringe and needles are to be used for injection. So now is I will perform hand hygiene. So this will ensure that medications is sterile. So next is we prepare the medication. So be sure to check the label twice while performing medication, and check the expiration date on label to be sure not outdated. So this will reduce error and to eliminate distractions. So first is we're going to remove the cap covering top of an unused vial to express a sterile rubber seal. So keeping rubber seal sterile. So since this vial is already has been used, so cap is already removed. So by this, we firmly briskly wipe the surface of the rubber seal with an alcohol swab and allow it to dry. So allowing the alcohol to dry prevents needle from being coated with alcohol mixing with medication. So next is pick up a syringe and remove a needle cap. So with the vial on flat surface, so we insert the tip of the needle with beveled tip entering first. So inserting beveled tip first and using the pressure prevents scoring or rubber seal which could enter the vial or the needle. Next is we inject the air into the air space of the vial. So holding on the plunger, so hold plunger with firm pressure. So air pressure within vial sometimes forces plunger backward. So injecting air before aspirating fluid creates a vacuum needed to get the medication to flow into the syringe. So invert the vial while keeping firm hold on syringe and plunger. So hold the vial between the thumb and middle finger of non-dominant hand. So inverting the vial allows the fluid to settle into the lower half container. So keep tip of the needle below fluid level. Next is to allow the air pressure from vial to fill gradually with medication. So if necessary, so pull back slightly on plunger to obtain correct amount of solution. So positive pressure within vial forces fluid into syringe. So when desired volume is obtained, so position needle into the air space of the vial. So we tap the side of the syringe barrel carefully to dislodge any air bubble and inject any air remaining at top of syringe into the vial. So forcefully striking barrel while needle is inserted in vial bends the needle. So accumulation of air displaces medication and causes those errors. So next is we remove needle from vial by pulling up on barrel of syringe. So accidentally pulling plunger rather than the barrel causes plunger to separate from barrel, so resulting in loss of medication. So we hold the syringe at eye level, so at 90-degree angle, to ensure correct volume and absence of air bubbles. So remove any remaining air by tapping barrel, so to dislodge air bubble. So draw back slightly on plunger, so and push plunger upward to eject air. So do not eject fluid, so recheck volume of medication. So holding syringe vertically allows fluid to settle in bottom of the barrel. So if medication will be injected into patient's tissue, so change needle to appropriate gauge and length according to route of medication. So inserting needle through rubber stopper dulls beveled tip, so new needle is also sharper. So for multi-dose vial, so make a label that includes a date of mixing, concentration of medication per milliliter, and your initials. So this will ensure that future doses will be prepared correctly. And some medication need to be discarded a certain number of days after mixing of vial. So next is the ampule preparation. So this is an ampule. So we tap the top of the ampule lightly and quickly with finger until fluid moves from neck of an ampule. So this will dislodges any fluid that collects above neck of ampule, and all solution moves into the lower chamber. So we place a small gauze pad or an opened alcohol swab just above the neck of an ampule. So placing pad around neck of an ampule protects our fingers from trauma as glass tip is broken off. So this will protect our fingers and face from shattering of the glass. So we draw up medication quickly, so using a needle long enough to reach the bottom of an ampule. So system is open to air contamination or contaminants, so needle needs to be long enough to access the medication for preparation. So needles filter out any fragment of glass. So we hold the ampule upside down or set it in flat surface with needle in center of an ampule opening. So do not allow needle tip or shaft to touch the rim of an ampule. So it's because broken rim of ampule is considered contaminated. So now is we aspirate medication into the syringe by gently pulling back on the plunger. So withdrawal of plunger creates negative pressure within syringe barrel, so which pulls fluid into the syringe. So keep needle tip under the surface of the liquid. So this will prevent aspiration of air bubbles. So if air bubbles are aspirated, so do not expel air into the ampule. So it's because air pressure forces liquid out of ampule and medication is lost. So to expel excess air bubbles, so we remove the needle from the ampule. So we hold the syringe with needle pointing up, so like this. So we tap the side of the syringe to cause the bubbles to rise toward needle. So we draw back slightly on plunger and we push plunger upward to eject air, so do not eject fluid. So withdrawing plunger too far removes it from barrel. So holding syringe vertically allows fluid to settle in bottom of the barrel. So if syringe contains excess fluid, so use a sink. So we hold the syringe vertically with needle tip up and slanted slightly toward the sink. So slowly eject excess fluid into the sink. So then recheck the fluid level in syringe by holding it vertically. So the position of the needle allows the medication to be expelled without flowing down the needle shaft. So rechecking fluid level ensures proper dose. So we scoop the needle to recap. So compare label of the medication with medicine ticket for final time at patient's bedside before administering medication. So this is the third accuracy check. So then we return the unused multi-dose medication vial to shelf, drawer, or refrigerator. So proper disposal of glass and needle prevents accidental injury to staff, and it will control transmission of infection. So that's all for the vial and ampule preparation. So now is I will going to perform the administering injection. So first is we're going to perform hand hygiene. So this will ensure a sterile medication. And then before going to patient's room, compare the patient's name and name of medication on label or prepared drug with medicine ticket. So it is because it is the only, the most and reliable and legal record of medications that patient is to receive. Then we take medications to patient at correct time. So this will ensure intended therapeutic effect and complies with professional standards. So we now ask the patient with his or her name or identify patient using a name tag. So then we compare with the information on patient's medicine ticket. So this will ensure correct patient. Then we explain the purpose of each medication, its action, and possible adverse effects to patients. So this will help minimize patient's anxiety. And then we perform necessary pre-administration assessment. So and then keep the sheet or gown draped over body parts not requiring exposure. So this will respect the dignity of patient while area to be injected is exposed. And then we select appropriate injection site. And then we inspect the skin surface over the sites for bruises, inflammation, or edema. So the injection sites need to be free from abnormalities that will interfere the medication absorption. And then now we help the patient to comfortable position. So the relaxation of site will minimize discomfort. And then we relocate the site using the anatomical landmarks. So injection into correct anatomical site prevents injury to nerves, bones, and blood vessels. And then we clean the sites with an antiseptic swab. So we apply these cotton swab at the center of site, and we rotate outward in a circular direction for approximately 5 centimeter to 2 inches. So the mechanical action of swab will remove secretions containing microorganisms, and then we hold the swabs or the gauze between third and fourth fingers of the non-dominant hand. So the gauze or the swab remains readily accessible when needle is withdrawn. So next is we remove the needle cup by pulling it straight off. So this will prevent the needle from touching the sides of the cup, that will prevent contamination. And then we hold the syringe between the thumb and the 4 fingers of the dominant hand. So quick, smooth injection requires proper manipulation of the syringe parts. So now is we administer injection into the intradermal. So with the non-dominant hand, we stretch the skin over the site with forehand or the thumb. So needle pulses tight skin more easily. And then with needle almost against the patient's skin, so we insert it slowly with bevel up to 5 to 15 degree angle until resistance is felt. So advance it through epidermis to approximately 1/8 inch below skin surface. So by that, we can see the needle tip through the skin. So this will ensure that the needle tip is in dermis. So we inject medication slowly. Normally, we can feel resistance. So if not, then needle is too deep. So remove and begin again. So slow injection minimizes discomfort at size. So while injecting the medication, so we notice that the small bleb, 1/4 inch in diameter, appears on surface of the skin. So we should instruct the patient that this is just normal. So the bleb indicates that the medication is deposited in the dermis. So now we withdraw the needle while applying alcohol swab or the gauze gently over sites. Support of tissue around injection site minimizes discomfort during needle withdrawal. So we should not massage the site because massaging causes underlying tissue damage. So then we draw a circle around perimeter of injection site and discard the needle enclosed in safely shield and attach the syringe into puncture proof. So this will prevent injury to patient and healthcare personnel. So after that is we perform hand hygiene. So again, this will reduce transmission of microorganisms. Then we have the site read by the physician within appropriate amount of time. So bruising or induration indicates a complication associated with injection. So now is we're going to administer the intramuscular. So for this, we position the ulnar aspect of our non-dominant hand, so just below the site. so just below the site, and pull approximately 1 to 1.5 inches down or laterally to administer in a Z track. So we hold this position until medication is injected. So with our non-dominant hand, so we inject the needle quickly at 90-degree angle into the muscle. So the skin in these tracks create zigzag path through tissues that seals needle track to avoid tracking of medication. And then if patient's muscle is small, so grasp the body of muscles between thumb and finger. So this will ensure that medication reaches the muscle mass. So we insert the needle into the muscle with smooth, steady motion. So after the needle presses into the skin, so grasp the lower end of the syringe barrel with non-dominant hand to stabilize the syringe. So we continue to hold the skin tightly with non-dominant hand, and then move dominant hand to end of plunger. So do not move the syringe. So smooth, steady motion reduces pain at moment of injection. So pull back the plunger. So if no blood appears, then inject the medicine slowly. So this time, it is necessary to ensure that needle is not in low flow blood vessel. So then, smoothly and steadily withdraw the needle and release the skin. So this will allow for medication to absorb into the muscle before removing a syringe rather than leaking back out through the tract that needle is created. So we withdraw the needle while applying alcohol swab or gauze gently over site. So, and then we dispose this syringe. So proper needle disposal prevents needle stick injuries. Then we apply gently pressure or gentle pressure. So do not massage the site. So because massaging the area may spread the solution to the underlying subcutaneous tissue. And then we dispose. So we now help patient to a comfortable position. So this will reduce the patient anxiety and discomfort. And then we discard the needle. So as what you have seen in the syringe into the puncture-proof or the leak-proof receptacle. So as if that is the leak-proof receptacle. So this proper needle disposal prevent needle stick injuries. And then again, we perform hand hygiene. So this will reduce transmission of microorganisms. So then we observe for any allergic reaction. So nurses observation determine the efficacy of the medication action. So now we chart the medication dose, the route, the site, and time and date given immediately after giving medication. So it is because we should document the administration after giving the ordered medication. So because it's the standard protocol. So lastly, so we report any undesirable effects from medication to the physician. So medication errors have significant implication on patient safety, and error detection through an active management and effective reporting system discloses medication errors and encourages safe practices. So that's it. That concludes the preparing of injections from vials and ampules and administering intradermal and intramuscular injection.